This is NICU Babies Parent Support with Catherine Whitaker, a podcast from Hand to Hold, a national nonprofit that provides free personalized support, resources, and community before, during, and after a NICU stay. My conversations here will focus on education and personal stories with medical and hospital professionals, counselors, therapists, and NICU moms and dads from across the country. Whether you're preparing for a NICU stay, you're currently there, or you're months and years past your stay, you belong here. The NICU is hard. We're here to help. I'm your host, Catherine Whitaker, the mom of 6 children, including my very own NICU baby, and I'm so honored you're here. Howdy, y'all. Welcome back to the podcast. It's good to have you here. I was thinking that we are already in September. So September is a big month for me in that it is the anniversary of our NICU stay and the birth of our son. So you're going to hear a little bit more about that. But I decided that today I really wanted to dive into a topic that is near and dear to my heart, and that is PTSD, post-traumatic stress disorder. This is a little bit of a trigger warning. We do talk about trauma and some of the triggers that you may experience in the NICU. So if you're not ready to hear that, pause it, come back to this episode later. I found an exceptional guest. She is a board member for Hand to Hold, but she also is a clinical psychologist really specializing in the NICU. And I wanted us to talk. So in this episode, you're going to hear us talk a little bit about PTSD for the moms, dads, and caregivers. But you're also going to hear us talk about PTSD for babies. And I'm not sure how many of you have thought or even considered that our babies can leave the NICU with PTSD. I mean, I knew that my baby, I often call it prematurity, the gift that keeps on giving, that there are some things that our kids, as they get older, begin to struggle with. But it never dawned on me that our kids could possibly have PTSD. So Tiffany and I definitely dive into triggers and how you differentiate between anxiety and PTSD, because there are a whole host of things that you can walk out the door besides the discharge papers from the NICU. And so you're going to hear Tiffany and I talk about all of that. And my hope is that one, you're going to feel seen as we have this conversation, but two, that you're going to have some great resources that you're going to be able to walk away with and know that you don't have to live this way, that you can go through this and you can come out better on the other side. So my guest today is Dr. Tiffany Gladdis. She is a licensed clinical psychologist in neonatology, and she's the medical director of the Office of Equity and Diversity at Children's Mercy Hospital, as well as an associate professor at the University of Missouri at Kansas City. Dr. Gladdis provides therapy and support to families in the Fetal Health Center, NICU, and NICU follow-up clinic, and her clinical interests include attachment and bonding, trauma, infant and perinatal mental health, and BIPOC populations. And she also serves on the board of Hand to Hold. And so with that, let's chat. Well, Tiffany, thank you for being here. I have so many questions for you, but I always love when I visit with people who are in a professional career related to medicine. I always like to ask them, how did you get there and why specifically clinical psychology with a specialty in the NICU?
Sure. That's a great question. And I just want to say thank you for having me. I'm really excited to be here. And I'm very passionate about working with NICU families. So I always love an opportunity to share and educate and talk about what I do. How did I get to be a NICU psychologist? Let me think of the short version. I always knew that I wanted to be a psychologist that helped children and young children. I did not know that there was even a such thing as a NICU psychologist or even an infant mental health psychologist, which is the model that I practice out of, until I got close to internship. And there was an opportunity for me to work at a community mental health organization that served 0 to 5-year-olds who had experienced trauma. And I really was drawn to this work because I felt like it was the earliest opportunity for intervention that would help set these kiddos off on a smooth foundation to hopefully have a productive, happy, and successful life. And when I was on fellowship at University of Colorado at Children's Denver, I had some exposure to the NICU and another psychologist who had done some work in the NICU. And that's when that option became a reality for me. And I was like, man, working with moms who are pregnant and babies who have been born into trauma is an even earlier opportunity to intervene and both support the parent and the baby who have just gone through something really hard. So that's kind of how I got directed into this particular area of infant mental health or child psychology.
I love how the doors kept opening and you just sort of kept backing up till you got to the beginning. I don't know that very many people know that clinical psychology exists for children 0 to 5. That's surprising
Yeah.
to me. I think most of us have heard, if we have children, have heard of adolescent or young adult psychologists and people that work in clinical psychology. But I guess I always thought of early intervention happening in other places, but it makes sense that it also exists in psychology. I love how you kept backing up. So we're gonna back all the way up. So I know that when you were talking about babies being born into trauma, sometimes moms are thrust into trauma unwillingly. Like they have no idea that they're going to be in the NICU. And that in and of itself brings about anxiety. Even if you are the calmest, most prepared person, there's always some anxiety in going into a new place and having a baby with some unknowns. So, how
Right.
do you differentiate, Tiffany, between anxiety and PTSD?
Sure.
Which stands for post traumatic stress disorder for some people that don't know that.
Absolutely. That's a great question. So, when we're talking about PMADs or perinatal mood and anxiety disorders, there's three main categories. There's perinatal depression, perinatal anxiety, and then perinatal psychosis. And so PTSD falls under that anxiety category. And so there are a lot of similarities, but they are two distinct diagnoses. So the perinatal anxiety, and we use that term perinatal because we know that it can happen during pregnancy and afterwards, not just postpartum. And so perinatal anxiety is going to be more of the persistent worrying and checking on your baby and having concerns about their safety, which when you're a NICU parent, all of that is pretty reasonable, right? Because there are
Right.
some very real situations that parents have anxiety about. Um, Postpartum PTSD is going to look more like avoidance of the stimuli or the trauma, which sometimes is the baby. For some parents, it's the NICU itself because perhaps they witnessed the code. It could be of the hospital where they may have had a life threatening delivery where they hemorrhaged and they almost died. It's often characterized by flashbacks. So parents will often tell me that they replay the scene in their head over and over, thinking about what they could have done differently or where things went awry or replaying what a doctor said or did or even what they may have saw or witnessed. It can also be a sense of hypervigilance. So, just being very attuned or alert or paying attention to things. And for some parents, that ends up looking like being what the medical team may say over involved, but it's really that parents, desire to protect their child. And for other parents, it might be withdrawal, so not showing up as much. Many of our families, when their child is in a very critical situation to where they're not sure if the child will survive or not, will withdraw to protect themselves emotionally. And a lot of this is unconscious. It's not like you're saying, I'm not going
Sure.
to engage with my baby because they may die. But it can feel really scary to build a relationship with a baby that you don't know if you're going to leave the hospital with. And so those are some of the behaviors or symptoms that show up specifically in the NICU setting when it comes to PTSD.
That sounds a lot like grief in the sense that there's no one right way to grieve. And it sounds like what you're saying is that there's no one right reaction, that it can manifest itself in a lot of different ways. In fact, as you were going through the different ways and you said replaying certain memories, I think most NICU moms and dads and caregivers have some moments that it takes us a while to reconcile and move
Hmm.
past because it's so traumatic and in many cases unexpected. So,
Absolutely.
Tiffany, if there's a mom that's listening to this, I know you talked a little bit about what their reaction may be and sort of how that manifests, whether it's anxiety or PTSD. Um, how do you know that it's PTSD? Because that's a word that I think gets thrown around a lot. And in many cases, I know that a lot of people told me, oh, Catherine, you don't have PTSD. Only people who go to war, only soldiers, men and
Mm,
women who go off to battle can experience PTSD, or what you experienced was traumatic, but it wasn't that traumatic.
mm.
And that's a hard thing to hear. But how do
Oh,
you
yeah, for
know?
sure.
Yeah. How do you know the difference of what you're feeling is true anxiety, or if you're starting to move into the category of PTSD and may need some help moving past that?
Yeah, one of the things that we are very clear about when it comes to trauma, and my hospital is a trauma informed care institution. We've done a lot of training with our NICU staff, all the way from our unit secretaries up to our neonatologists on what trauma is and how it shows up in families. And it breaks my heart to hear you say the statement that you just said, that someone might say, oh, what you went through is not that bad, having not gone through it themselves. And we're very clear that trauma is how an individual defines it. So no one outside of you can tell you if something that you've gone through is traumatic or not. For one person, a trauma might be witnessing someone get murdered. For someone else, it might be losing their childhood animal, and there's a wide spectrum. And so for any NICU family that is listening to this, the NICU is a trauma, I like to use the word infested environment. And so please know that no one can tell you that what you've gone through is not traumatic, because undoubtedly it is. How you can kind of tell the difference. And it used to be very common that we did think PTSD is something that veterans experience. It's something that, that happens when you come back from war and you hear a car backfire and you think it's a bomb, that kind of thing. But we have expanded our knowledge and awareness and normalization of what PTSD is. And it can absolutely be related to a number of different events, like the NICU, like if you were robbed, like if you had a house fire, like if you experience interpersonal violence. Those sorts of things also qualify for PTSD. So if you're experiencing any of those symptoms that I just described, including distractibility, that's another big one for our NICU families. Oftentimes, and you may be able to relate to this, parents will be present for something like rounds or a care conference, and they will hear all of this information. And yet after rounds or after the care conference, they're kind of like, they may ask the nurse, what did they say or what's going to happen? And it's because the brain is so preoccupied with safety and security that it often does not have much space to take in other information. And so sometimes I've seen medical teams get frustrated. Like, we've repeated this to the parents over and over. We've explained this so many times, and they're still asking the same questions. And it's because their ability to encode information when you're in a post traumatic state is very difficult. And so, I think it's hard to get out of the NICU without having any, post traumatic stress symptoms, even for the families that are only there for a short time. They don't know they're going to necessarily be there for a short time. And anytime yourself or an extension of you, which is your child, there's a threat of danger or safety, there is the opportunity to experience trauma.
Yeah, I mean, you don't check into the NICU and they say, "Oh, so you guys are going to be here for about 5 days," and then they look at another family, "You guys are going to be here for 3 months." I mean, it really is for most of us day to day, and sometimes you think it's going to be a couple of weeks and it ends up being months, or sometimes you think it's going to be several months and it's a few weeks. So
Exactly.
there's no real diagnosis when it comes to that. So when it comes to PTSD, because I know that the NICU doesn't play favorites, that NICU babies come from all different places and spaces in the world.
Yeah.
I know that you have a real emphasis on addressing the BIPOC community and PTSD. Do you see a higher rate of incidence with PTSD in that community? And if so, how do we address that?
Yeah, that's a really great question. And there needs to be a lot more research in that area. One of the issues with that is that oftentimes families of color don't seek treatment when they experience perinatal mood and anxiety disorders. So whether it's postpartum depression, anxiety, PTSD, they often don't seek out a therapist. And so there aren't necessarily the numbers in data that represent that population. One of the things that we do know is that Black women and Latina women are 3 times more likely to experience a perinatal mood and anxiety disorder. And so I think we can deduce that similar numbers are true for PTSD, especially for Black women who we know historically have greater rates of infant mortality and maternal mortality, and just experience a lot more discrimination and racism when it comes to the perinatal world. So many women of color come into a delivery situation already traumatized from something they may have experienced before, whether it was a prior delivery or just a prior encounter with the healthcare system.
And it's the layering of trauma.
The layering of trauma, for sure. I work with many families who often say that when they are in the NICU, and this may be true in other hospital settings, not just the NICU, but they often feel like they're being judged. They often feel like that they aren't able to use their voice and ask questions. I hear different feedback than I hear from families who are white. And so I think it's just really difficult for families of color to navigate the trauma of the NICU, like you said, giving the trauma that they already come into the setting with.
Well, I'm grateful. I'm hopeful that there will be more studies done, because I think that when we learn how it affects one community, it benefits all communities. So PTSD in the NICU, I think, is a relatively new term in the sense that people are starting to validate that, yes, it can actually happen. And then when it does
Absolutely.
happen to different populations, how do we address it and how do we go forward? So if people are thinking about, they hear PTSD and maybe they may not know, maybe can you give us an idea of maybe what some of those triggers might be? So if maybe you're experiencing PTSD and you're thinking, or maybe you're having difficulty understanding this thing is the thing that is causing me to really struggle, what might some of those triggers look like or sound like?
Sure, sure. So, one of the things that people often describe is an increased arousal to stimuli. So, they may find that, let me back up a little bit and say anybody who's ever been in the NICU knows that it's sensory overload,
Yeah.
right? There are babies crying, there are alarms going off, there are people having conversations about different babies in different areas. And so all of that can be very overwhelming. And some parents will describe when they're in the NICU environment, there's a sense of like heightened arousal. So they may notice that their heart rate is increasing. They may notice that they're getting sweaty palms. They may notice that there's kind of a knot in their throat or in their stomach. They may get kind of sweaty. Some parents may even start to shake or have more shallow or labored breathing. And all of those are symptoms that maybe you're being aroused by the environment that you're in. So those are all symptoms. Another trigger can be for a lot of parents that I work with, if the doctor brings up anything about redirection of care, that can also be a trigger that starts to kind of activate some of those same symptoms. Whenever our body has experienced something very traumatic, which when your delivery ends up in the NICU, that is a traumatic situation. Our body's main goal is to keep ourselves and our baby safe. And so it's very easy for that trauma alarm to start to rise at the smallest indication that myself or my child could be in danger. And like I said, hearing those alarms, or even a doctor just presenting at the bedside, or even overhearing what might be going on for another baby at a bedside next to you or across from you, all of those things can start to turn on that alarm and say, be aware, be aware, be aware. Are you safe? Is your baby safe? And sometimes it's hard to turn that alarm off. Every little thing can kind of activate it. And so then you start to walk around the world in this way that is really unsafe and unhealthy. And so it's really important that when you start to notice that this is your experience, that you reach out for help to a therapist who can help you try to calm that alarm. Because it's normal to have anxiety when your child is in the NICU. But what I often tell parents is we want to help you be on top of the anxiety rather than the anxiety being on top of you. Because
That's
we
good.
know when the anxiety is on top of you, it gets in the way of you being able to have a healthy interaction and bond with your child. It gets in the way of you being able to make good clear medical decisions for your child. It gets in the way of you being able to care for the other kids that you may have at home or your partner, or if you've gone back to work. And so this is a little bit of a plug for NICU psychologists, but if you work in a NICU and you don't have an embedded psychologist who's right there on staff and can help families work through these type of things, you really should have one. And if you don't, you should certainly have a community referral source where you can recommend families, or there's lots of national organizations like Hand to Hold, like Postpartum Support International, that have free online services to help families work through some of these very common and normal responses to having a child in the NICU.
Ooh, that was good. As you were talking, if you're watching us on YouTube, I was nodding a lot. I think it's important to mention this, and I know that you alluded to it, is that trauma, PTSD, anxiety, all those things that may occur when you're in the NICU, they don't play favorites in the sense that no matter how educated you are, the color of your skin, how old you are, that we don't know how our bodies are going to respond to trauma.
Right,
So it's not as if someone's doing it right and someone else is doing it wrong. It's
right.
just we're unique individuals who respond differently. And sometimes we need extra help in moving through that. So I want to assure someone that if you are having to seek help, you're not broken and you're
Right,
not doing it wrong. You just need
right.
extra help, sometimes like
Yeah.
our babies do in the NICU. This podcast is produced by Hand to Hold, a national nonprofit, but we're more than simply a podcast. Be sure to download our app, join one of our support groups, or find one-to-one support, enjoy counseling, find loss and bereavement support, participate in a peer-to-peer mentor program, or check out our news, articles, and family stories at handtohold.org. All of that is at no cost to you. Hand to Hold's mission is to provide personalized support before, during, and after a NICU stay to help ensure that all NICU families thrive. So sometimes we hear about people that, I know you mentioned counseling. What are some options that people can tap into if they're looking for treatment for PTSD or really any of the other things that you talked about, whether it be psychosis or depression or anxiety?
Usually, that first line of defense is psychotherapy. And that can happen with a psychologist or a master's level therapist to really be able to process the trauma. One of the types of therapy that I often use with families who've experienced trauma is narrative therapy, just because many families have told the medical aspect of what's happened to the doctors or the nurses, but they don't get to add that emotional component. And oftentimes they don't feel comfortable sharing that even with their family because they don't want to scare them or they don't want to make them think that they're not okay. And so when I meet with families for the first time, I invite them to tell their story of how they came to be in the NICU. And I invite them to go as far back as they would like and tell as much or as little as they feel comfortable with. Because for many of our families, that trauma story may have started at 20 weeks when they found out their baby had an omphalocele or congenital diaphragmatic hernia, and they didn't get to even enjoy the pregnancy in the way that they had desired. You mentioned that word grief earlier, and many of our families are experiencing grief. Even if it's not the grief from losing their child, it's the grief of loss of experience. You know, when people imagine having a baby, for most people, it's an exciting time. They have this idea of what it's supposed to look like. And when at 20 weeks, you're told, we don't know how this is going to go, or your baby may not make it through the pregnancy, or may die shortly after, or may have lifelong consequences, it's difficult to have that imagined experience. And so allowing them to process that and tell that story. And for many families, that story gets told throughout the process of our time working together, because the more you tell it, the more you gain mastery over it, rather than it being something that just happened to you. Now you can have some ownership over that story, and that helps decrease some of the trauma that can be associated with it. Because when we experience a trauma, the number one thing is that we had no control. And so when we're retelling that story, it gives us an opportunity to have more control than we had when we were going through it. And it kind of helps some of the rewiring in our brain associated with that trauma.
I want to say this again, that the more that you
Yeah.
tell it, the more that you can master it. That was really, I think, affirming for some of us who have been in the NICU, that the way that we process and the way that we heal is by sharing our experience.
Yes, absolutely. And I think another piece to that, whether it's PTSD or any other perinatal mood and anxiety disorder, and I'm glad our society is moving towards this, but it used to be that if you're not enjoying being a mom, it's something that you have to suffer in silence, right? There's
Right.
not a lot of permission given to say, I hate the NICU, or I hate that I'm in this situation, or when I look at my baby, I don't feel in love with them, because those are all of the things that people expect. And so with therapy, there is a space created for you to say all of those things and feel safe, that you can't say with your friend or your mom, or sometimes even with your partner. And so that psychotherapy is the first line. For some families, depending on their situation or even their pre-existing mental health history, there may need to be another level of like psychiatric help that's needed. So they may need to see a psychiatrist and get psychotropics to help manage anxiety, or if they're experiencing severe depression. So adding medication is often helpful, but I encourage people not to do that in isolation. Having the psychotherapy in addition to medication really is helpful, because the medication may help lessen the symptoms, but it's not going to help you process the trauma. And so doing those things together is really helpful. I do a lot of couples therapy in our NICU, because the trauma of the NICU, I often say, does one or two things to a couple. It can either bring them closer together, or it can drive a wedge between them. And when there are families who have really significant issues that they're dealing with their infant, there are big decisions to make, and parents are not always on the same page. And so having a third party that can help them practice healthy communication and make sure that they're hearing each other clearly, and helping encourage them to maintain the bond between themselves as partners, and not just wear the mom and dad hat, which is easy to do when your child is in the NICU,
Yeah.
is really helpful for the partnership. And then also, I would say group therapy is often helpful for a lot of families. Being in the NICU can feel very isolating. If you don't know anyone who's been through a NICU experience before, it can be really difficult to try to help other people understand what you're going through, because it's hard to even fathom what it is like. And so,
Mhm.
in a group therapy setting, you get to talk with other people who are going through what you're going through, even if it's a different diagnosis or, different aspects. They know the stress and the heartbreak of not having the desired experience. And even in that, people can get ideas about how to manage, or even just be able to leave some of that stuff that they're carrying around in that group therapy session, again, with other people who understand.
That's so good. We had a few episodes earlier. My husband and I went to couples therapy, and we had an episode about that. And then we also interviewed a clinical psychologist talking specifically about partner and couple therapy and how beneficial that can be, particularly for a family that's been in the NICU. It is not an easy place to be. And that is maybe a huge understatement.
Yeah.
So sometimes, and this was new to me, that I don't think I realized. I mean, I think I knew this, that babies experience trauma in the NICU. We know that,
Hmm.
but I don't think that it maybe was, I guess, evident to me that our babies can experience PTSD and that it might look very different. I know our preemie is now almost 14 years old.
Oh,
And there are some things that I look at and think, oh, I call it prematurity, the gift that keeps on giving. But let's talk a little bit about that. If you're looking at your baby or young child or even maybe adolescent and wondering, are they carrying some things, PTSD or trauma from the NICU? I guess I thought because they were so little that I was holding on to all of that, but now I'm
yeah.
starting to realize that they are too.
Yeah. It used to be that we thought, babies were not impacted by the environment around them, that, they weren't affected by parents arguing or sitting in a car seat or getting pokes and prods because they were just babies and they won't remember. But what we know now is that that's not true. And that babies are absolutely impacted from birth by the things that are going on in their environment. And like I said before, the NICU is a trauma filled environment. And especially for babies who are born extremely premature, they're in this sensory field space much before their little sensory system is even developed enough to be able to tolerate everything that they're exposed to. And so it is absolutely true that babies can experience post traumatic stress disorder. And it can look like a lot of different things. I also work in our neonatal follow up clinic. So I see our NICU graduates until they're about 3 or 4 years old in our outpatient clinic. And some of them have what we called, your white coat syndrome. Like they've had because it doesn't stop for a lot of families in the NICU. Depending on what their diagnoses are, they still have all of these appointments and follow up after, and they're always getting blood drawn and pokes and prods and procedures and hospitalizations and all of these things. And sometimes just even the presence. So their trigger could be a white coat of a doctor because they don't know what's going to happen. Because the last time they saw someone in a white coat, something very bad happened, in their eyes. And so we do know that the experience that happened very early on can be triggered later in life. So that aversion to needle pricks or like the trigger of seeing the white coat. And some of our kiddos, especially as they get older, even just when they pull up to the hospital, there can be and you can see them start to have a meltdown, or they can, once they get older and more verbal, they may start to say, "Mommy, I'm scared," things like that. So we do know that that can happen, that some of those post-traumatic stress symptoms, even very early on. Now, we do not often diagnose babies that are under 12 months with PTSD, just because their ability to have representation that would qualify them for some of the criterias like re-experiencing is very limited. But we know that their brain is able to process some things that they may not be consciously aware of, and then impacts them later, if that makes sense.
Right. No, it absolutely does. I mean, it makes sense that they would have lasting effects, and it makes sense that now we're recognizing that we need to address those. I mean, I think as our son has gotten older, that's become more and more apparent to us. And thankfully, in the last decade, I think, and certainly in the last 5 years, there's been a real openness. I think it was sort of hush hush, like when my husband and I started therapy. We didn't want to tell that many people because there was this stigma associated, and now it's almost as if it's okay for you to admit that you
Yeah,
are struggling and that you need help, and that maybe your baby might need help as well, that you didn't fail them as their parent.
right,
Instead, you're helping them grow
right.
and process something that absolutely changed their life. So I'm grateful that that's where we are now, because that was not the case when our son was born 14 years ago.
Mhm.
So Tiffany, if
I,
there's a mom, or oh, go ahead.
I was just going to add one thing to the PTSD part, because part of the work that I do is supporting parents, but also it's dyadic work. And I mentioned before that the model that I practice from, and a lot of NICU psychologists practice from, is called infant mental health. And the basis of infant mental health is building a safe, secure, positive bond and relationship between the infant and their primary caregiver. And one of the things we know is that when that relationship is secure, healthy, and happy, it is a buffer to stress for that
Mm.
baby. And so, one of the reasons why it's so important for us to identify and treat the mental health experiences of parents is so that they can be emotionally available to have that secure, healthy bond and connection with the baby. And when they have that with the baby is able to tolerate the stressors of their environment in a much more healthy and manageable way. And that sets them up for the rest of their life. And so I just wanted to add that piece because I think it's so important, especially when it comes to the PTSD part. And I'm often preaching to parents, like, you have to take care of yourself. You have to take care of yourself. And coming from the angle that if you won't do it for yourself, you have to do it for your baby. Like, your baby needs for you to be well adjusted in order to lay the foundation in their brain for healthy attachment, which will impact them for the rest of their lives.
That's incredibly encouraging to hear. I think sometimes as moms and dads, we sometimes feel like we're failing our kids, but to know that if we can love them well and also love ourselves well and do what it is that we need to do to
Mhm.
address the hard things, that our babies become the beneficiaries of that, not just us. So I'm really
Yes.
glad that we said that you stopped me and said that.
I want to add one other thing.
Yeah.
I'm so
No,
sorry.
you're good. No. Keep
Said
going.
dads, and I want to talk about dads a little bit because I feel like they often get left out.
Yeah,
And
they do.
all of the attention usually goes to the birthing person or the mom and the baby, but dads are going through this as well. And oftentimes they've experienced the most trauma because they've seen the mom bleed out, or they have had to make the decision of whether or not to go with baby or to go with mom. And dads don't have as much permission in society to emote and to say this is really hard or I'm not doing well. And one of the things we know is that 33% of NICU fathers experience PTSD, and that they often have severe symptoms even 6 months postpartum. And so I think what that tells us is that, and I've observed this with families, is that dads have a lot of pressure to kind of hold it together and be the strong one for the mom. And really, they're having all of this that's going on for them as well. And so I think it's really important to highlight that so that we as medical professionals or organizations that are caring for the whole family unit do just that, care for the whole family unit, and that we're checking in with the partner to say, how are you doing? What do you need? It's okay for you not to be okay as well, because fathers and partners are struggling just as much as the birthing person and the mom.
Yeah. That's really good. We had a great episode with some dads, and it's been really beautiful to hear their experience and also giving other men. Sometimes you need another man to give you permission that it's okay.
Yeah.
I love asking for advice. That's how I end every podcast episode, is asking for your advice. So if there is a mom or a dad, maybe Tiffany, who's listening to this and they're feeling overwhelmed, stressed out, and they don't know how to process this really hard place, what would be your best piece of encouragement to them so that they can get to a better place?
Yeah. Well, first, I would want to validate for them. I think sometimes hearing you're not crazy, this is normal to feel this way. I would be more surprised if someone is going through a NICU experience and feeling completely themselves.
Yeah.
And so it's okay, is my first piece of advice, to feel your feelings. I often say to parents, the NICU experience is much like that nursery rhyme when it comes to your emotions. Like, you can't go around them, you can't go under them, you can't go over them, you have to go through them. And that's the way you end up as healthy as possible on the other end of this trauma. So that's the first thing. But then I would say seek help. You don't have to go through this alone. There are trained professionals who are specifically interested in helping you manage this situation as best as possible. And so look in your community, ask your institution, where can you receive help? Where can you get therapy? Someone who can listen to you, give you, and sometimes people build therapy up to be a lot more than it is. Sometimes you just need somebody to hear you.
Yes.
A lot of what I do is create a containment, a space for parents to just talk and to share, and to feel validated in what they're going through. And it's amazing how healing just that can be. And so know that it's okay and it's normal, and you don't have to do it alone. Seek help.
That's an excellent way to end it. Tiffany, thank you for such good advice and good encouragement for parents that find themselves in a hard place.
My pleasure. Thank you so much, Catherine.
I'm not sure that there is an episode that I have ever felt more seen. I hope that's how you feel after listening to that. In today's 2-minute take, can I cram all this in 2 minutes? I don't know, but there were a few things that she said that really, really resonated with me. If you were watching on YouTube, you saw me shaking my head vigorously. But there was one statement that she said that I want to say again, is that they want to give us tools so that you are on top of your anxiety and your anxiety is not on top of you. And I think that you can substitute many things like that so that your PTSD is not on top of you, but that you are on top of your PTSD. I think for a long time, I thought that maybe I had escaped the NICU unscathed, or maybe like healthy enough, right? Like I'm writing about it, I'm talking about it, so things are fine. And it's not until you maybe graduate a few years from the NICU, you have a chance to visit with other moms, dads, and caregivers who were there in that place, and you start to tell your story. And I was so glad that Tiffany shared this, that she said that the more that you tell your story, the more that you receive mastery over your story. And that there is real value and worth in sharing. I mean, that's why we have this podcast, y'all. It's why we share stories. Why do you think stories are so powerful? Because our words and our stories can heal. They can heal other people. They can heal us. And your story is your story, and it is important. It is valid, and the feelings that you have are valid. And I think back often to that person that told me, oh, like, I know the NICU was hard, but it wasn't that hard. Like, I think you're over exaggerating. Like, I don't really think that you had PTSD. I was glad that Tiffany said, you know what? Your trauma may look very different than someone else's. And so that person sharing that with me, maybe their threshold for trauma was higher. I don't know. But for a long time, I doubted myself. Like, was it really that hard? Yes. In fact, I think it may have been harder than I was willing to admit. So if you are listening to this and you are currently in the NICU, or maybe you're listening to this and you are long past the NICU, just know that you are seen here, and we have resources for you. Both Hand to Hold has resources. The greater NICU community has resources. Perhaps it's your hospital or your primary care or your OB-GYN or your pediatrician. There are resources available, and you are not broken if you ask for those resources. So please take Tiffany's advice and all the things that we talked about and feel encouraged that you can be better tomorrow than you were yesterday. So with that, I will see y'all next time. Thanks, y'all, for listening to NICU Babies Parent Support. Every parent and every experience is welcome here. If you are a NICU parent and you're finding yourself in need of support, please download our app. You can find it in the Apple Store or on Google Play, Hand to Hold. And if you love today's episode, you can share it, you can subscribe, and you can most certainly review it. We would love, love, love your reviews. It's how we reach more NICU parents. Thanks, and I'll see y'all next time.